just letting people drift in, electronically drift in from the waiting room. Give a few more seconds for folks to filter through. Well, I'm very excited to be launching the third session, or the third gender equity series. We started this in 2019 as a way to stimulate conversation around gender equity, and here we are 3 years later. We have amazing offerings for you this year, so I hope you stay tuned. The first topic that we're covering this year is what we had envisioned was rising from the ashes of COVID-19. And we planned this back in the spring when we were very sure that by this time we truly would be rising from the ashes. And it's not quite the reality that we have, but I think there are a lot of things that we can learn from the pandemic that we've been through. And so we're very happy this month to have Cary from the Vermont Commission on Women talk to us about the impact of COVID-19 on women and children in the state of Vermont. Just a few housekeeping notes. We welcome everyone's efforts in towards gender equity in our community. And so if you want to become more involved, or if you have questions, please feel free to reach out to myself, or if you know any of the folks that are on the Gender Equity Steering Committee, please reach out to them. We're happy to have you involved and really want to hear about your questions and your thoughts. And there also is a link on the Office of Diversity, Equity, and Inclusion website where you can put in suggestions for speakers or topics. And we can also, I think if Tiffany can grab that, we can put it in the, put it out to you here. So you'll have that link. The other thing I just want to say is that gender equity is not women's work, right? This is community work, and this takes all of us to create an equitable and inclusive environment. And I think it has a lot to do with examining our own perspectives, trying to get into another's perspective and see the world from their eyes and in their shoes, and then examining what kind of power and privilege we might have that could be leveraged to create more equity around us. And I tell you that we do have a true ally in this gender equity work that we're doing here at the College of Medicine in our Dean, Rick Page, who's been a great support to the Gender Equity Initiative and to myself personally, and to the women and gender minority faculty, staff, and students. And so I'd like to invite Dean Page to say a few words now.
Thank you very much, Dr. Doherty. And I'm just here, first of all, to welcome people and thank you for attending. Also to acknowledge Dr. Ann Doherty in her leadership. Wow, it's starting the third year that this gender equity education series has been going on. And I make it a point never to miss these events, and universally they've just been outstanding speakers and have gotten people thinking. I thought it was an interesting comment that the gender equity is not women's work. Sometimes I look at it as men's work, but I think it's all of our work. And just as you say, Dr. Doherty, we aspire to a community that's characterized by cultural humility, kindness, and respect, that is the most inclusive, equitable environment that we can provide. And that is work. It's work for all of us. At the same time, it ought to be fun work, and it ought to make us better. And it ought to be something that we embrace. And part of that embrace is acknowledging we all have much to learn. And that's where this education series is so valuable. So with that, I will be quiet get out of your way, and I look forward to hearing our guest speaker, and I provide a warm welcome to our guest speaker that I know you're going to be introducing now. So thank you for the opportunity to say hi. Stay well.
Thanks, Dean Page, as always. And so now it's my pleasure to introduce Cary Brown. Cary Brown will be our speaker for the next hour or so. She is the executive director of the Vermont Commission on Women, though her tenure at the Vermont Commission on Women started before joining the staff as a commissioner herself. The Vermont Commission on Women is active in legislative issues such as equal pay, lactation in the workplace, and paid family leave. They're great advocates at the state level. Cary Brown additionally has organized many programs supporting education, training, and careers for women and girls, including a nationally recognized summer program for girls called the Women in Technology Camp. She has a bachelor's degree from Haverford College and a master's of public administration from Norwich University. And we're so happy to have her here in the state working with us on gender equity issues, and also to hear from her today about the impact of COVID-19 on women and girls in the state. Cary.
Thank you so much. It's really a pleasure to be here. I'm so grateful to have an opportunity to speak with you, but I'm also just so grateful for the fact that you're doing this series, that you have this work that's happening, that you've prioritized gender equity in the way that you have. It's not every place that is doing that, and it's incredibly valuable. So thank you so much for that. So thank you for the introduction as well. That's a pretty good synopsis of where I'm at. I just wanted to tell you a little bit more about the Commission on Women, though, for those of you who might not be familiar with it. We are a state agency, and we've been around since 1964, working to advance rights and opportunities for women and girls in Vermont. And we do that through public education, through policy work, and through an information referral service that we have. So that means that sometimes people are coming directly to us looking for assistance, but it often means that we're going out and working with the public and with policymakers to try to address some of the underlying inequities that we see for women in our culture. And when the pandemic hit, as with everybody else, it really kind of upset whatever plans we had already for 2020. And we shifted to working pretty hard on looking at what was happening for women in the pandemic. And it was, as I'm sure many of you know, and I'll talk more about later, pretty striking. There was immediately it was immediately clear that this pandemic was going to have a different kind of impact on different people in our society. And so we started trying to document that. Right away, we instituted a dashboard for COVID-19 data, which you can find on our website. And I'll be sharing some of the data from that with you later on. And this was a way for us to try to capture some of the key data points, such as some health outcomes, things like infection rates and testing rates, also things like unemployment and the economic impact that it was having on women, just so we could sort of track this and see it. And we've been doing this now for over a year, and so it's pretty interesting that we've got some tracking data available. We also spent a lot of time in the legislature offering testimony on the impact of COVID-19 on women, trying to help legislators and other policymakers think about what they might do to address some of this. When I think back to a year and a half ago or whatever it was, and we didn't really exactly know what we were getting ourselves into, did we? So we've learned a lot in the interim. And one of the things that we did at that time was support a grant program for minority and women-owned businesses that through the Agency of Commerce and Community Development. And that was the first time in my knowledge that the state has ever given money specifically for businesses owned by minorities and by women. And so that was actually really great to see that recognition that because there's a different kind of impact on different folks, you need to tailor your solutions differently, which is the kind of thing that we just advocate for across the board. But so what this is really making us do, and we're not the only ones at this, but it's been really crystallizing for us that what we need to do is not look just at whatever is happening today, whatever's happening right in front of us. And there are, there've been lots of urgent situations that have come up because of the pandemic, but we're trying to remember to always keep that focus on, aside from what fire is burning today, what are the coals underneath that have been there all along that we're able to ignite these fires that we're now putting out. And so to really look at the structures and the systems that have been in place, that weren't created by COVID, but have been in place, that are resulting in the inequitable outcomes that we're seeing, and to try to ask ourselves and to ask people that we work with, what can we do about those underlying inequities so that we don't ever have to face this particular kind of crisis outcome again. The next pandemic will come along and it'll be something else, but it's a real opportunity for us now to look at what's kind of underneath all of that. So I wanted to just kind of help us to step back a minute and think about that really big picture. And the fact that we live in a society with an economy that is absolutely dependent on unpaid labor and on underpaid labor. And it really has been since the beginning. This country was built with the labor of enslaved people. And when slavery was outlawed, people did anything they could to continue to find ways to operate with as close to slave labor as they could get away with, right? So we've had indentured servitude, and we've had child labor, and we've had companies like coal companies that are kind of entrapping people into working for them so that their whole livelihood and their whole means of supporting their families is tied to whatever the company makes them do and how they live. We've used the labor of immigrants. We've exploited the labor of immigrants, and we all know about our railroads being built by Chinese immigrants and the numbers of people who died doing that. And prison labor is another one. The 13th Amendment that abolished slavery of the Constitution only actually outlaws slavery outside the conditions of as a punishment for a crime. So, it's perfectly allowable as a punishment for a crime. And Vermont is actually currently working on an amendment to its constitution that would adjust the wording to say slavery and indentured servitude in any form are prohibited, which would be different from what the US Constitution says. But at any rate, women have always really been a key part of that. Women have been doing the unpaid caregiving and the unpaid work at home that keeps everything else running. So we've been taking care of children, we've been taking care of the sick, we've been taking care of the elderly, we've been doing all of that work at home that keeps a household running, that kind of household manager sort of work. And this is in the early days of our country, when a lot of people's lives and their financial lives were focused at home, whether they were running a farm or a ranch or something like that, people were working at home in order to generate whatever the means were to support their families. But then as times shifted and men started going outside of the home to get jobs that paid a wage, women were left behind, still doing all that work at home, but now they're not earning a wage for it. And so we really have this kind of structural tradition that everything is built upon. And we see that reflected in a lot of the ways that workplaces operate now and the ways that schools operate now. School is closed in the summer and it only goes until the middle of the afternoon and things like that, because there's this expectation, maybe not an expectation anymore, but because it's built on this foundation of moms were home taking care of children while dads were working outside of the home. And so as things have shifted in American families, our economy has not completely caught up to that. And so now that more and more women are, going outside the home to work, and it's not an unusual thing anymore. When we look at the kinds of jobs that they're doing, they're overly concentrated in that kind of caregiving labor that people sort of associate with the kind of work that you do to take care of people at home. And so those kinds of jobs, like childcare workers, like teaching, like other kinds of caregiving jobs, they are women are overly represented, and the pay is they're undercompensated for it. And that really reflects the fact that traditionally our society doesn't value the labor that women have done traditionally in the home as much as it values the labor that men have done outside the home. And so I would argue that the reason why jobs like childcare and personal care attendants pay poorly is because they have traditionally been done by women and not the other way around. But of course, that contributes to the overall earnings of women in this country. And it's a big reason why we have a disparity in the amount of money that overall women have compared to overall men have. So just to give you a couple of examples, not that you probably need them, but childcare workers, Vermont has one of the highest average wages for childcare workers in the country. And that is a little bit over $16 an hour. So I think we're number 2 in the country after Washington, D.C. So that just, that's what good is, about $16 an hour. And I always have to tell people this story about my own family. When my 15-year-old son got his first job, got a job at a creamy stand, and he was making more money per hour than my 20-year-old son, who had been working at a childcare center for 2 years. So 2 years of working in childcare, and he still couldn't make as much money as the 15-year-old dishing out creamies. So that's the kind of value that Vermont puts on the people who take care of children. And then healthcare work where women are really overrepresented is one of the areas. Is like personal care attendants, home health aides, the kind of work that sort of looks a lot like what parents do when they're taking care of their children, things like changing diapers and bathing and helping people get dressed and putting clean sheets on the bed. And I had an eye-opening experience when my dad was in hospice care and at home, and someone had to come over and cut his toenails and take care of his feet. And I learned about how important that is to somebody's overall health. Never would have occurred to me that we had to worry about cutting his toenails. And once I saw what went into it, I realized this is also not something that I could just take care of myself, because there was a lot more involved in foot health care than I had ever known. And so having a professional do that was great. But this is another field that pays incredibly poorly. In Vermont, it pays just about the same as childcare. And we're not quite at the top of the range, but we're very close to it nationally with personal care attendants as well as in childcare. So these are conditions that have existed pre-pandemic, and because we've been relying so heavily on unpaid and underpaid labor, there have been significant negative outcomes for women. And what we see is widespread inequity in things like income, in opportunities in general, career development, legal rights, bodily autonomy, safety, and many other areas. So, for instance, I mentioned the wage gap before. This is something that's pretty commonly talked about in popular culture, and it's a much more complex issue than it's often made out to be. But overall, what we know is that women are really negatively impacted financially by all these things that we've had, all these inequities that we've had in place. And so actually, I think I want to start sharing. Oh, hang on a second. I start sharing my screen. Yeah, so I'm going to start sharing my screen and share a couple of slides with you. And let's see, bear with me. Okay. All right. Can you all see that? Okay. We're okay on this? Okay, great. All right. So let's see. So we have hold on one second. I'm sorry. I'm actually going to stop this. I'm going to stop this and I'm going to go back to just talking to you. Okay. I don't want to lose my place. All right. So another, so one of the things, some of the ways that we know about the kinds of negative outcomes are women are much likely to work part-time. They're about 79% of women are working part-time compared to 91% of men. Women are more likely to live in poverty, and even more so if they have children or if they're single. Unmarried women who have no children. In Vermont, 11.4% of them live in poverty compared to 3.5% of single men with no children. Single women who have children, 36.7% of them live in poverty. And that's compared to 16% of men. And then if they have children who are under 5, it's even greater. 47.1% of the single mothers with children under 5 in Vermont are living in poverty, almost half. And that's compared to 14% of men in the same situation. So that's a huge, huge disparity that we see there. And then when we look at overall women who are working full-time in Vermont, almost 40% of them don't make enough money to meet their basic needs. And that's as determined by the legislature comes up with a basic needs budget on a regular basis that says this is how much money you actually need to make to live in Vermont. Almost 40% of women working full-time in Vermont don't meet that. And it is worth noting that this is really a Vermont problem in general, as much as it is a women in Vermont problem, because it's like about 34% of men in Vermont working full-time don't make enough to meet their basic needs either. So definitely have an overall issue. And then also it affects things like domestic violence. As I'm sure you all know, domestic violence is much more something likely to be experienced by women than by men. And it has an impact on their ability to make a living and support their families. In Vermont, about 28% of victims of domestic violence have to take time off from work for various reasons, and 87% of that time is unpaid time taken off work. So they're losing money because of experiencing domestic violence. All right, so then what happens when COVID comes along? So COVID happens, and this is a pandemic that by its nature has caused major crises in healthcare and has required people to stay home. And so it's hitting the two big domains of women's unpaid and underpaid work. It's hitting that caregiving domain, and it's hitting that work at home that keeps everything running domain. So it's completely expected that the pandemic would be much harder hitting on women than on men. And this is exactly what we've seen. So for instance, as we were talking about before, women make up more than their fair share of the workers who have been deemed essential in the pandemic. In Vermont, women are 91% of nurses. They're 82% of healthcare workers overall, and 82% of personal care service workers. And that includes childcare workers are lumped into that category as well. And at the sort of early on in the pandemic, the Vermont chapter of the American Nurses Association did a survey of their members to find out what is going on for the nurses who are working through COVID-19. And they found that over a third of them said that they did not feel adequately protected in their workplace. Even more than that, expressed concerns about their workplaces being equipped to handle COVID-19. About 44% said that their workplaces were not prepared to handle it at all. And about 70% of those who commented on when they were asked about PPE said that they were rationing or had a shortage. That was early on in the pandemic, so things did get better as it went along, but there was quite a significant amount of time when those frontline workers, as you all know, were really in danger's way. They told stories like surgical masks running out, being afraid to go home because of what they would pass on to someone at home, not being able to see their kids for weeks on end, and just feeling like everything was out of whack. And there have been some disparities in healthcare and health outcomes for women in Vermont. And so, for instance, 77% of healthcare workers who have COVID-19 are female. Illness visits are higher for women than for men. And it could be because women are taking better care of their health and going to the doctor more often. When we look at long-term care facilities, there's a higher rate of cases among women, both among residents and among staff, quite a bit higher actually. And then when we look at prevalence of pre-existing conditions in COVID-19 patients, it's higher for women. When we look at cases among people with neurological conditions and intellectual disabilities, it's also higher among women. And so this is having a potentially long-term impact. And then the other thing is, when people needed to stay home and couldn't go to work at all, some of the hardest hit industries were those that had a disproportionate share of women. So for instance, in Vermont, 81% of our tipped workers are women, and they're working in jobs such as food service, cleaning, kinds of jobs that just disappeared overnight during COVID, when the pandemic hit, and have been pretty slow to come back. And then with schools and childcare being closed, someone needed to take care of the children. And I mean, one of the things that COVID has taught us is, or made really clear, we always knew this, but it's made really clear that someone always has to take care of the children. And whether it's moms at home doing it unpaid, or whether it's grandparents doing it, or whether it's friends and family, or whether it's paid people, or whether it's schools, our whole economy depends on somebody taking care of the children. And so we already had a lot of women doing that without being paid for it. And during COVID, that just grew significantly. And it didn't just grow for parents, it grew for mothers. So mothers and fathers both started spending more time taking care of their children at home, but it was proportionally more for mothers. They were already doing more, and then they did even more after COVID, or during COVID. So women reduced their work hours more than men, 4 to 5 times as much as men did. They left work completely to care for their children. In the early closure states, women who had school-age children were 20% more likely to reduce their hours, 30% more likely to leave work completely than in the states that hadn't closed yet. But in those same states, men's work hours didn't change significantly. So it was really women who were reducing their time. Back in September of 2020, when we were really at the height of this, we saw that nationally more than 4 times as many women as men left the workforce completely. And those are people who are no longer filing unemployment claims, and so are unrepresented in unemployment numbers. And when we look at kind of the whole year, between January 2020 and January 2021, almost 1.5 million mothers left the workforce completely. And we don't know what the long-term outcomes of this are going to be. We do know that that overall, tons of people have left the workforce, tons of women have left the workforce completely. We don't know exactly why or what's going to happen when things change. In Vermont, during the year of 2020, over 28,000 people left the workforce completely. And that's a lot of people in Vermont. Because we're so small. But we don't know who those people were in Vermont, because the Vermont Department of Labor isn't reporting on the gender or the race or the age of those folks. So we just know 28,000 people have left. It's very likely that many of them were mothers based on national trends. No particular reason to think that we're a lot different in Vermont than the rest of the world. So I am actually having a conversation just the other day with a friend of mine who has a daughter who just started kindergarten. And they made it through this past 1.5 years or so with the childcare being closed completely, with it going back. And and shorter hours. And so I think, she was really feeling like, okay, let's just get to kindergarten and then something will be okay. She'll just go to school all day. But then she was looking at and she worked part-time, and she'd been thinking, I'll be able to go back to working full-time when school starts. And then she looked at the school holiday schedule and see they're closed for a week at Thanksgiving, and realizing that she has to do something about after school care and all of the complications that are not even related to COVID anymore. They're just basic scheduling incompatibilities with a full-time job. And she said, I guess I'm not gonna find a full-time job now, because I don't know how to juggle that. And this is really what a lot of women were experiencing during COVID. Is it's just a little bit too much to try to figure out how to make this all work. It was hard enough before, and now forget it, so I'm just going to be just forget it. And so the overall rate of workforce participation among women in the US dropped down to levels that we haven't seen since the late 80s. And so it's like a generation's worth of progress for women in the workplace, just undone in one fell swoop. And we'll see what happens as we, go into the future and see if this makes a difference. In Vermont, when we look at the unemployment figures, we've seen that the share of women compared to men who have been filing unemployment during this whole period has been consistently higher than typical. Usually we see a bit more men than women. Really flipped during the pandemic. Nationally, it flipped. In Vermont, it flipped. And it's been slow to recover, much slower to recover in Vermont than it has nationally. Nationally, it's kind of getting back a bit to about 50-50. Not in Vermont. We still have a lot more women still collecting unemployment. So this is one of the things that we've been tracking in our dashboard, and we'll keep tracking that to see what happens in the future. Okay, so that's a lot of bad news, right? There's always a lot of bad news when I give a talk about anything concerning women. There's a lot of bad news, but I actually feel very hopeful and very optimistic, because everywhere I go, I hear people talking about this idea that we have these underlying structural inequities in our society, not just for women, but for people of color as well, for low-income people, and we have to address these structures. And there's a lot of things that we can do, some of which Vermont is taking, I think, the lead on, and that we can be proud about. There are a lot of policy solutions. So just as some examples, paid family and medical leave, that's a really big one. You all probably know that the US is literally one of the only countries on the entire planet that doesn't guarantee paid family leave for people when they have children. And there are a few states that have instituted their own programs, but Vermont is not one of them. That could help a lot. One of the ways that it can really particularly help, aside from just putting more money into people's pockets and allowing women to not have to make the choice between their job and taking care of their families, is it's for men as well. And so if we can really especially build policies that are encouraging men to take paid family and medical leave and use it just as much as women do, that I believe will help to kind of shift that burden of family care responsibilities a little bit, hopefully, so that men are taking care of children as much as women are. That's the ultimate vision. Paid sick time, that includes time for taking care of things that come up because of domestic or sexual violence. Vermont does actually have a law about this. Every employee in Vermont is guaranteed a particular amount of paid sick time, and you can use it to go to court or something if you're a victim of domestic violence. That's not the case in a lot of other places that have this. Flexible work. We are another kind of in the lead state where we have a law that guarantees employees the right to request flexible working arrangements. Doesn't guarantee their ability to get them, but you can ask your employer for a change in your schedule, for instance. So if you need to pick up your children at school at 3 o'clock every day and you want to start work earlier in the day, you can ask for that without any fear of repercussions. And another one would be predictable schedules. Is not something that we have a law about in Vermont, but it is something that there's a lot of talk about. So that, I mean, just to give another example from my family, my younger son recently quit a job at a grocery store because in large part because he never knew when he was going to work, and he never knew how many hours he was going to have. He didn't get the schedule for the week until Friday, for the week that started on Sunday, and so he could never make any kind of plans. And this is a high school student. He doesn't have a family to take care of. He's not trying to support anybody, you know, and even for him, it was like, this is too difficult. I'm going to go get a job where I don't have to worry about that. And so imagine if you're trying to schedule childcare or actually support a family. Having a decent minimum wage is another one, and this is one where Vermont is working. We have a higher minimum wage than most states. Probably has something to do with why our average wages for childcare workers and personal care workers is a little bit higher. Healthcare for everybody, and this is not something we currently have in Vermont. We're in better shape than a lot of other places, but we still have people who just don't have access to affordable, adequate healthcare. Same with childcare. You know, we're investing more money into childcare than we have in the past, but it's absolutely nowhere near enough to make it affordable for families and also to make it affordable for the workers to actually work in childcare. Definitely something there's a lot of talk about in the legislature of how do we support living wages for the people who are doing this work, as well as supporting affordable tuition for the people who need the service, but we're a long way off from that. School schedules, as I mentioned before, that are built around the idea that parents work would make a huge difference. Resources to support elder care, because this is something that women are doing a lot more than men are. Vermont just recently has introduced a law, and I think it passed the House. I don't think it's passed the Senate yet, of allowing dependent care as a campaign expense for political candidates. It's a small kind of a step, but it's one that recognizes that in order to run for office, you might need to hire somebody to take care of your child or other dependent. And then also laws that address sexual harassment. Again, Vermont is making good progress in this area, as well as all kinds of other workplace discrimination. It is, there's a long way to go with that though, and this is something that where employers can have in some ways potentially much bigger impact than the law can, actually, by establishing a culture and a climate in their workplace that doesn't tolerate even the kinds of sexual harassment that don't rise to the level of actually being illegal. There's, you know, a lot of the worst stuff that happens is the stuff that you couldn't technically sue for, but it can make for an intolerable work environment. So other things that employers can do outside of, you know, what policy changes can happen, employers can, aside from that, they can provide paid leave, they can provide flexible work and other parent-friendly policies. There was a study done by McKinsey this year that asked people about going back to work after COVID, and over half people said that they would prefer a hybrid kind of a work environment, so that they were working at home some and working in the office sometime. But if you ask the parents of young children, almost all of them said that that's what they wanted. There were almost no parents of young children who said that they were interested in going back to work in the office full time. So that's a shift that I think employers are going to have to make. And then finally, a really great tool for employers is a tool that we have on our website called the Leaders in Equity and Equal Pay Equity Audit. And this is a tool, a spreadsheet, and it's a whole handbook that goes with it that employers can use to do an assessment of, are they paying their employees equitably? And it's geared towards understanding about gender equity and also racial equity. And it's free and it's downloadable and there's comprehensive instructions and ways. So that's a resource that's available. And then just finally, really what all of this is working towards is real culture change. And we have an opportunity, I think, for real culture change that will recognize and reward the work, the true value of the caregiving work that women are disproportionately doing. And so I think that that's the end game, is recognizing the value of caregiving work, whether it's done at home, whether it's done in a professional setting, rewarding it and supporting it. And that's what's going to get us out of all this. So that is the note on which I will end, and I'm happy to take any questions.
Thank you so much, Cary, for giving us that snapshot of. I loved your metaphor of the fire and the coals below it. I was having a conversation with a friend who runs a small business in the state, and we were talking about fostering equity, particularly gender equity. And one of the things we were talking about was paid family leave or around childbirth or a new child arriving, and talking about how it would be wonderful to have extended leave for two parents, if there were two parents in the relationship, and how that would be a symbol of how we think about equity and creating equity within the family. But then he said, but I can't do that. I can support that, but as a small business owner in the state of Vermont, I can't do that. So what do you say to people who are in positions like that?
Yeah, that's a really common response. And it's really true that a lot of small businesses in Vermont, they can't afford to do that. They just can't. And that goes towards the argument of a social insurance program that requires everybody to be contributing something into it. And then it's a benefit that's available to everybody, and it's administered through the government. It's not a requirement on employers to provide this out of their own pockets, because it just isn't really practical for a lot of employers to do that. And right now, the federal government is pursuing the possibility of a federal level paid family and medical leave insurance program. And that would be, I have no idea if it's really going to happen or not, but they're talking about it. The president's pushing hard for it. But that would be a much more efficient way to spread this cost among hundreds of millions of people instead of a couple 100,000 people in Vermont. So it's a lot more practical. So I'm hopeful about that. And I think there are a lot of other benefits like that if we figured out ways to kind of pool and efficiently distribute resources, could make it affordable and practical for people to do it.
I would ask people, if you have questions or thoughts for Cary Brown, to please put them in, use the Q&A function, and we'll get to them. There is a question here about your thoughts around some of the work week parameters that are perhaps a bit old, or have been in place for a long time, including the 40-hour work week, and how we could modernize that and what the impact of that would be.
Yeah, that is a great question. I think, again, that's kind of getting to this idea of how did that work week come about? How did our current structures for what work looks like and how it functions come about? And the 40-hour work week is a big improvement over a lot of conditions before that, where people were just kind of working all the time. But it still is, for a lot of families, I think it's not always the most compatible, and it's certainly not necessarily compatible with school schedules. And so if we're thinking about what's happening with children while parents are at work, then there's a real disconnect there. And I also think that during this time of COVID, when so many people have been working at home, and then just kind of a natural byproduct of that is working more flexible hours. We certainly see it anecdotally. I'm sure everybody on this call knows what I'm talking about, that people are working, maybe they're working more, but they're working at times that are easier for them to do it. And so when the school bus arrives and your child gets home and gets off the school bus, and you want to give them a snack and hear about their day and get them settled, you can do that if you're working at home and your hours are shifting around that. And so I think that those are the kinds of conversations that employers are going to are going to have to be having with them, with their employees and with each other, as particularly as we're looking at the real crises that people are having with labor shortages across the country, and in Vermont, it's really bad. And so as employers are thinking about what are we going to do to make it compatible to have a family and to have other parts of your life and to have a paying job, they're going to have to be creative about that. And I think we're going to have to be open to different kinds of structures. Absolutely.
And I think that's part of what the hybrid work model offers. And I think that's why it's maybe attractive, especially to folks with young children, because you can work when you have those natural breaks or when you're most productive, rather than in an 8 to 5, 9 to 5 structure. I did get a question from someone about some of the statistics that you were mentioning in the first half of your talk, and if they're available somewhere or if you can share them.
Yes, I can. In fact, I have a notes document that I can share with you all that has all the sources cited in it. So I'll just email that to you and you can share that out with people. I think that'd be better than the PowerPoint that I didn't end up showing you. So yeah, I'll be happy to do that.
Perfect, great. We have a question in the chat about the pipeline program, and I'll just read the description. The person says, my admin is struggling to work and manage at home, and it's negatively affecting her work, which is then leading to me struggling to meet my job expectations. And then that is leading to my supervisor to struggle doing their job successfully. And now when we advertise for leadership positions, we're seeing few women applicants. What are your thoughts? It's almost like a trickle down effect, or a trickle up. I'm not sure how to say that, but you can see how each position, the struggles at each position is connected to one another.
Yep.
So how do you increase folks in leadership, women in leadership?
Right. So this is one of the things I'm most worried about in the after effects of the pandemic, is that if we've had so many women leave work, and so many women do things like decide they're not going to go for a full-time job after all, they'll just stick with part-time, or women who are finding that it is just a little too much to juggle, and so they're going to cut back, or they're going to find a job where they can do that, then that's going to impact the women who are even available for those leadership positions down the road. And this might take a little while to show up, but I'm nervous that we're going to see progress lost in that area. And we have a Women in Leadership and Public Life report that we're working on right now that'll be out in the next few months. And so we can kind of see things like the police chiefs or fire chiefs or college presidents and things like that. And you can really see how the increase or the lack of increase or representation of women at the lower levels can lead to, you don't see women at the higher levels either. And so it's a huge concern. I think that one of the ways to address this is for employers to really be thinking about what shifts can they make to their expectations from their employees, or to the way the job is structured, that make it more compatible with taking care of a family. And I don't mean to say that like, oh, I can just sit down and figure that out and make a change and institute it tomorrow. In some cases, like the example described, it's complicated. It's going to be really difficult because you're talking about lots of people whose work is impacted, but I think it's doable.
But you can also see that the impact is large, right?
Yeah.
Because it's one person's issue with childcare that has downstream effects. So from that sense, it may be worthwhile to address.
Mm-hmm. Mm-hmm.
We have another question. I am a woman research scientist whose postdoctoral fellow could not return to full-time work due to childcare issues. And I'm just going to paraphrase here, but when I go to funding sources, they're not interested in why the lab is not maximally productive and whether it, and that it has to do with childcare. How do we address this and get childcare into that dialogue?
Yeah, I think that is a great question. I think it's up to all of us to keep raising that issue and to say, well, the reason why it's not meeting your expectations is because of childcare. And, really overall, what we have to do is put more resources into childcare from various places. So this is something that perhaps grantors could start to think about funding the supports that make it possible to do the research, such as childcare. I'm sure that would not be a very popular idea, but I think they should think about it. And the university can think about what are the things that we can put into place in our own structures that support our employees being able to do the kind of research that we want them to do, such as childcare. And so they're big questions, but I think it's worth continuing to raise them. And I think that I know that for a long time, taking care of your children has been seen as kind of a private, personal thing that you're supposed to just do and you're supposed to figure out, and it's not anybody else's responsibility. That it's not like, I don't know what to compare it to, but my car needs to be vacuumed out because it's full of crumbs and mice are starting to live there. That's my problem that I need to take care of, right? And so to try to put that on my employer might be seen as ridiculous. And I think a lot of people feel the same way about childcare. Like, you just need to figure this out. It's your own personal business, just figure it out. But as I was saying before, it's not, because for any of this to work, somebody has to be taking care of the children. And so it's to all our benefit. It doesn't just help us all, it's actually necessary. The whole thing will fall apart if no one's taking care of the children. So we just got to keep saying that.
There's a note in here that postdoc fellows can apply for additional stipends for childcare of up to $2,500 a year from NIH. And I'm a few years from preschool childcare, daycare, but my remembrance was that it doesn't cost $2,500 a year. So that is a help, but won't pay for it. There's another question / thought. Well, flexibility is a positive, it's also a negative. I feel like the lines between work and non-work activities has blurred, and now I'm, quote, working all the time, which is leading to burnout. How do we establish a flexible schedule with boundaries?
Yeah, that's another one I have heard a lot. I can't tell you how many people have told me that they started working more when they were working at home than they had before. And yeah, those lines are kind of blurry, and it can be really helpful, and it can also be really difficult. Several months ago, the state of Vermont was talking about how they were going to come back and with their workforce, and were people going to continue to be allowed to work remotely? Were we going to expect it? And there was an idea tossed out at one point that maybe we would just make remote work as a default, and since it seemed to be working well, and I was one of the voices saying, let's not do that, because it doesn't work great for everybody. What works for people is being able to have some control over their work environment and over their work hours, not necessarily to be told you have to work in this particular place in this particular way. And so there are plenty of people who are not necessarily more productive at home, or again, a hybrid kind of a thing. I mean, I know that I work much better when sometimes I can go into my office and work there, and sometimes I can be at home and work there, and to have that flexibility to be able to do that. But it does also definitely require employers recognizing that their kind of potential for exploiting that, and that they need to be checking in with their employees on a regular basis and making sure that they're not working too much, or that it is still working for them. And it also requires employees, I think, to be drawing some boundaries and trying to stick to those. But I don't want to emphasize that too much, because I don't want to make it sound like it's a personal failing so much if you found your work hours are just expanding beyond your control. It's really something that employers have to take some responsibility for supporting those limits.
There's a note also that UVM, the College of Medicine, and the Medical Center could do a lot by creating and developing a childcare system on campus and a before and after school program. And certainly we've had many conversations about that. if there are any other last questions, I'd ask that you put them in the chat here. And I want to thank you so much, Cary, for the work that you're doing, and for the Vermont Commission on Women to be a voice in our government. I think it's so important to have an advocacy group like the Vermont Commission on Women. So happy to have you as part of that. And I'll just give a couple of shout outs to some folks, particularly the Education and Professional Development Working Group, who are amazing and who do a lot of work around visioning these sessions and bringing them together. And Tiffany Delaney, the director for the Office of Diversity, Equity, and Inclusion, and Tammy Candido, our administrative coordinator, who is my personal hero, as well as the ComAV Dream Team, who Bruce in particular is here with us today, who keeps us running on track. The next event that we're going to have in this series is October 4th. Doctors Leanne Holterman and Jim Hudjak are going to talk about wellness to stress to de-stress, ? Pathways to wellness. And that's going to be a really exciting offering. And I also want to just put a little teaser out that the Office of Diversity, Equity, and Inclusion, the Gender Equity Initiative, and the Teaching Academy will be launching Women in Medicine and Science Peer Leadership Group. This will be a 6-month cohort that will work together to develop leadership skills, particularly designed for women and gender minorities faculty at the College of Medicine. So stay tuned for announcements for that. And I think that's it. I hope to see you at these monthly events. Please reach out if you have thoughts, questions, concerns. I'd love to hear from you. And thanks again, Cary Brown. And we're going to give everyone, we're finishing even a couple of minutes early, and you can have 2 minutes back to stand up, stretch, take a couple of deep breaths before your next meeting. Thanks so much.
Thank you.